Hello, ladies and gentlemen. Thank you for joining me today on this webinar class on natural treatments for gum and tooth infections. So we're going to cover, causes of gum inflammation, and we're going to talk about treatments for tooth infections, and of course, we have to talk about prevention of this type of inflammation and infection in the oral cavity in general. So, and we have some home remedies here. We got some products, and we got some guide tips that could help you for the rest of your life in better caring for your teeth and gums. So first, let's talk about inflammation in the whole oral cavity, which generally can be seen by inflammation along the gum line, redness, bleeding along the gums, inflamed gums, tender gums, just red. In fact, for animals, particularly dogs and cats, I'm always looking at their gums. Your gum tissue is a representation of your muscle tissue. Just like your teeth are representation or similar tissue as your bone tissue. So if you look at somebody's teeth and you see cracking, you see chips, or they're getting a lot of cavities, and this also is a sign of weak bones. But when you pull the lips down and you look at the gums, you are looking straight at somebody's muscle with really not much skin, in front of it. So you're looking straight at the muscle, just like when you look through the fingernail, you actually can see the muscle on the other side. So if you look through your fingernails and you see it's all red, it's very red on the other side, that's like muscle inflammation. Now, if you look at your gums or even an animal, a dog or a cat, and particularly a carnivorous animal, and you see there's like red lines along their gum line with the teeth, and it's the gums in general are very red, then this means they have muscle inflammation. And of course, this type of diagnostics book is very important with animals because they're not able to communicate their pain, but you can determine by looking at their gums that their muscles are inflamed by the redness. And then, of course, like myself, I put herbs in their food, and even change the food up a little bit to reduce that inflammation down. And I can monitor the progress by looking at the gums. So let's talk about a few things that if you do have these red, inflamed, tender gums, there are a few guidelines. You're basically on an anti-inflammatory diet. So what's inflammatory? Coffee is inflammatory, chocolate's inflammatory, all white sugar, not coconut, sugar, and not pure cane sugar. That's not inflammatory. It's the white processed sugar, which of course is in all processed foods. And of course, all chemicals and preservatives, all are irritants, we could say, to the body. But the real culprit is the sugar and coffee, particularly if it stays in the mouth. And then, of course, the nightshades, tomatoes. So if you have an inflammatory gum condition like gingivitis, and you're possibly going to have gum surgery, and you want to avoid that gum surgery, you're going to have to stop the chocolate, the coffee, the sugar, and all nightshades. What are nightshades, including? Of course, you know this. You've been watching my videos, and because you'd have to take them out if you had arthritis as well. Tomatoes, cooked tomatoes, tomato sauce, eggplant, bell pepper, and white potatoes, and a few other things like paprika. So these would all be removed. So you'd basically be on an anti-inflammatory diet to get that inflammation down in your gums. So that's one subject. Now, second subject, tooth infection. And we're going to talk about how to reduce the inflammation down in your tooth or your gums altogether, because once you have a tooth infection, well, then you have some more inflammation. So how can we avoid tooth infections? First of all, your toothpaste you're using is a big consideration. Now, I believe in powdered toothpastes. In India, there's many companies making powdered toothpaste. That's one there. But at least I would do one of this type of product, or we have neem toothpaste. This is probably the only good toothpaste I think on the market, or at least the best. I do keep a sample here and I show people, but the powders are better. And that's the easiest way to maintain your teeth. And definitely you don't want a toothpaste with fluoride and other sweeteners in it. So I make my own tooth powder, and that should be the main thing you should do, is brush your teeth after you eat. And of course, avoid all sugar, candy, gum, soda pops are all rotting your teeth. Yeah, I'm assuming you know that. But here's a very effective tooth powder, but many people could make this on their own. We actually give this out a lot for gifts. Seems like we got that opposite effect there. There we go. Okay, we flipped it around. And there we go. Khabir's tooth powder, at least you can read it. Whitens teeth, removes plaque, reduces mouth sores and oral inflammation, supports healthy gums. So, and you look at the ingredients. Clay, and we got the clay right here because we make this. So, of course, we have to have, where'd the clay go? Clay didn't make it. It's benedite clay. Didn't make it. So I think they were making a new batch for me and took it off my desk. But benedite clay, it's not very much. It's like 10-20%. You don't want too much clay, and you don't want to brush straight with clay. It's too abrasive. Maybe once a month just to get the plaque, but don't brush constantly with clay. And then next we put in, as per Ayurveda, the next ingredient there is triphala. And triphala, of course, as you know, is made up of 3 herbs: amlaki, vibataki, haritaki. So that's the cleaning. It's very good for the gums, just like it's very good for your intestinal lining. Cinnamon. Now, if you were to make your own tooth powder, you definitely want to start with a lot of cinnamon, little clay. And then neem. Neem is very important. You'll see all of these Indian formulas all have neem powder in them. I mean, even this one right here has neem powder in it. And even this mouthwash by the same company, which I really like, neem. See, so neem is critical for disinfecting the mouth, avoiding infection. Very important. By brushing with a powder with a little neem, and then rinsing with this mouthwash with a little neem, it will keep bacterial growth under control, which can lead to excessive, bacteria and destroy the teeth. And there are some other herbs in here too, which we'll go through here. Maybe some of them you know and some of them you don't know. Khabir is used for skin problems. So that is actually just there for the gums, not the tooth. But there you go, licorice. So you could mix some cinnamon, licorice, clay, little fennel. It's this kind of sweet. Now there's a little myclove. Sandalwood is anti-inflammatory. Now clove powder is very important. Now, clove, we even have a clove powder. Where'd the clove powder go? Oh, here's the clove powder. See, we're using their organic clove powder. And of course, you can rinse with a little essential oils like clove powder, peppermint essential oil. Even this one is frankincense essential oil. These also can be, as pure frankincense essential oil. Also anti-inflammatory. You can put a couple drops in some warm water, little salt, gargle with it, little neem oil, frankincense oil, clove oil, and gargle. You can make your own mouthwash. Otherwise, you could just buy this type of product, which has the neem clove in it. So what else we got in here? We're really breaking this down here, teaching you what's in it. Cardamom, oh, that's just for your breath. So you have a nice fresh breath that makes it taste good and sweet. And then black salt. Not, of course, the darker the salt, the better. There's the black salt. I mean, I've got blacker salt. It's kind of a pink salt, but it still is very good, rich salt. And we do use that to make our tooth powder. So that's the tooth powder. And as it says, let's look at those instructions. You wet your toothbrush and dab into the powder and gently brush, and don't rinse immediately. Very, very effective. For maintenance. Now that's not for infection. That's just for maintenance. What I just talked about, and use a very soft, brittle brush. In fact, I have a bamboo brush with like a natural type of fibers on a bamboo, even the wood. I don't even like plastic. even though brush. Mine's a bamboo brush with some natural fiber, so it's soft. You always want a soft brush. Don't ever brush too hard. Somebody told me, and that's what I told my kids, one way to know if your brushing is only too hard is only brush with your 2 fingers, never like this, just 2 fingers, and then you can't do it too hard. So I think that's a good tip. I didn't bring my toothbrush down for you. And then gargle and rinse with a little clove oil with a little salt. Salt water, you can gargle every day with salt water. Will help disinfect your mouth. Salt water is very powerful and very effective mouthwash. And you just can put other essential oils in it, frankincense oil for inflammation. You can put a peppermint oil in for freshness, and you can put clove oil in for a little pain. So that is how you would do every day, 2-3 times a day. Brush with your tooth powder, rinse with your natural rinse every day. Now, let's assume now you have an inflamed gum or you have a tooth infection. So it's now worse. You're thinking of going to the doctor. You're thinking of getting a gum surgery. Oh, one more thing, you should have good toothpicks. This is a nice one I like. If we're going to talk about 3 steps, again, it's the same company, and there's even neem on the picks. You can get another brand that has tea tree oil in it. But so there's your 3 steps. Let's review. Brush, pick, and rinse. Okay, and all 3 products have a little neem. So the pick, it's getting in between the teeth, and if you have any little holes or anything, you want to clean those out, because the tooth is only, you don't get the infection from the hole. You get infection from the food, and then ultimately the bacteria getting in the crack or the hole in your tooth and then getting inside your tooth. So you've got to keep it clean, and you got to keep food out, and you got to get any little holes. And this is a great little toothpicks, because one little package lasts a long time, and it's got that neem on it, so it's disinfecting. And then after I clean it, then I rinse. So once again, brush with a powder, not a cheap toothpaste. Clean with a toothpick with some neem. You can put a neem on it yourself, or clove oil or tea tree oil. Clean it good. And you can also use like a periodontal stick too, where you just have a little, you break off the tip of the toothbrush and you use it. And then third, rinse. At least with salt water, better with a few essential oils. Okay. So now if you do get an infection, then we got to up it. If it's a gum infection, we want like a gingivitis, we give you out frankincense gum, pure frankincense gum. This one is from Oman. When I used to do business in Abu Dhabi and Dubai, one time I went on vacation to Oman, and I went to the only frankincense market in the world, and I bought fresh frankincense. I bought 2 grades. I bought a burning grade just for burning, and then I bought the highest grade for chewing, and that's what it looks like right there. Very effective. So if you have gum, I will sell it only to those people who have like bad gingivitis. Like I'm just not going to sell it to anybody, because then I wouldn't have it someday and I can't get it again. So usually I put it in a little jar, and I tell people take a little piece and just chew on it every day. Amazing results for bringing down inflammation in your mouth. Frankincense. And again, you can rinse. If you just have inflammation, you rinse with salt water and some frankincense essential oil. And if you have pain, you rinse with the salt water and clove oil. So here we go here. And then of course I have a product for this. Let's take a look at it. This is a great product. Now this is the product that I give people who have bad bleeding gums, toothaches, and mouth sores, and even abscess. And you can see the ingredients there: turmeric, charcoal, bentonite clay, neem, Khabir, cinnamon, licorice, and clove. See, the real ingredient here that's really bringing down the inflammation is actually the charcoal, because it disinfects, and it has there's more neem, there's more clove. This one doesn't taste as good. You don't get the licorice, the fennel, the cardamom, and all the sweet tasting herbs in this one. This one doesn't taste good. It's got a lot more. It's black, as you can see from the Well, the other one is not. The other one has no charcoal. So the charcoal really makes a difference. In fact, you can just brush straight with charcoal. That's the secret. And it gives you results. So many people were, going to go to the dentist 1 or 2 days after their appointment with me. And I gave them this advice: brush with the anti-inflammatory gum, clean any holes out with the tooth powder, and then rinse with the salt water. And of course, if you have pain, and a couple drops of clove. But you have to clean the cavity, the hole, with the toothpick. And so you have to, make sure that there's no food in that spot. And of course, once you have a cavity that's infected or inflamed, then you have to brush after every meal. And this goes on for a few months. And then eventually the tissue heals over it. And, you don't have to be as adamant to brush right after every meal. And many people have had cavities. I met them 5-6 years later. They never had it pulled. The hole is still there. The cavity is still there, but no pain, no infection. Because you have to remember, the reason the dentist wants to pull your tooth out, well, it makes good money. Root canals are good business. Then he can cap it. There's a lot of financial reasons here. But the real justification is that it will get infected. So that means if you're capable of stopping it from getting infection, the cracking tooth, the cavity isn't the issue. The question is, can you prevent it from being infected? So you have to have these products at hand. And that's basically what my clients did. They had the infection, and then it was hurting. And then they followed my guidelines, took my infection formula here, and just kept it clean, kept rinsing. And then they had no pain. The pain will go away in hours, but you'll have to brush and clean after every meal for a while. And even the tooth starts to heal to some degree, but the hole will be there, the cavity will be there, and you'll have to keep cleaning it forever to a large degree, just not as rigorously as you would in the very beginning. In the beginning, you have to be quite rigorous and making sure you don't let any food get in the tooth until there's some tissue buildup. Now, when we talk about building your teeth and making them stronger, I am a supporter of the research by Weston A. Price, and he determined that it was the civilizations. If you're not familiar with him, he traveled around the world examining different cultures and looked at their teeth and figured out who had the good teeth and who had the poor teeth, and then looked at their diet. Well, they found out the people having raw milk from the cow or the camel or the goat had the best teeth. So he's a very strong advocate of dairy. And matter of fact, thousands of years ago, before Weston A. Price figured this out, Ayurveda figured it out too. Want to build your bones, want to build your teeth, it's dairy, cheese, particularly raw milk. People may say, oh, I can't digest milk. Well, that's a separate issue. If you can't digest milk, you can always improve your digestion. Some people, they don't have an adverse reaction to milk. But the question is, are you drinking raw milk? Are you drinking pasteurized, homogenized milk? I didn't bring the milk to the counter here. If I would have had it here, I would have gulped some raw milk down for you live, which I have done before, but I forgot to bring it to my desk. But I love raw milk. I drink it mostly in the summer. It's very cooling. There's, of course, different types of milk. Goat milk is warming, better for vata, weak people and frail people who want to build bones. And then cow milk is cooling and nurturing. So really, to build bones, like I have my bone building formula and bone building tabs. We have, for osteopenia, osteoarthritis, degenerative bone conditions, we have bone building formulas. And these, if you look at them, they say they should be taken with warm raw milk, either raw cow, if you're pitta, or raw goat milk, if you're vata or kapha types. And then you would take this every day. And then people notice that their fingernails start to get harder, their hair stops falling out, their teeth stop cracking. So that's just really the second phase. Once you let's call it, there's 3 phases to your tooth infection. 1, stop the inflammation and the pain for the gum or the tooth. 2, stay on it to not allow it to get infected again. And then 3, if it's in the case of the teeth, focus on building up and strengthening your teeth tissue, bones, we could say, and that would be with raw milk. There's other sources of calcium and magnesium, but I don't advocate synthetic vitamins in any way, because I only use and advocate products that are 100% natural, or we could say came from God and were not man-made. So that's why I don't use synthetic vitamins. And there's plenty of other sources of, and of course the fat soluble vitamins also very good for your bones, like vitamin D, but I would never take D3. That's made in a laboratory. I take my cod liver capsules and they have their D3, and I take them all through the winter, a couple capsules a day. So that gives me the A, D, and E. That's also good for bones because I tend to do less milk during the winter because it can be congestive. And I do raw milk in the summer because it's cooling. And this keeps my bones strong. Of course, I haven't been to the dentist for decades and decades, and I will confess, I do have a few teeth missing. They cracked, they broke, but these were the teeth that had work done, root canals done when I was a teenager. And then they slowly were brittle and damaged from the root canal, and they finally broke, and the doctor probably would have wanted to cap them, but I just kept going with my anti-inflammatory, my tooth powder here, and kept the infection at bay and just kept it clean. And over like 10 years, slowly the tooth just broke, and all I have left is my gum. But it never became infected. So that is the main point that you can learn if you're capable, like myself, of preventing the tooth from becoming infected. Then you don't have to go to the dentist. But if you're not capable of that, and it's hurting and its infection is getting worse, then you have no choice. But many of my clients have done it. It's a little more work to keep in your mouth clean, but many people would choose to rather do this than go down that slippery path of having root canals, and then the root canal destroys the teeth and destroys the root, and then later on the teeth break, and then you've got to cap them, and then you may have to wear dentures, so they make money out of you 2 or 3 times from your little cavity, and all you had to do was clean it out, prevent infection, and just leave the hole there and drink a lot of milk and bone building supplements like vitamin D and cod liver oil to keep your teeth strong so they don't crack. Okay, well, I hope that helped you. It's not my specialty. I don't advertise on my website that I'm treating tooth infections. I do get a lot of cases of gingivitis, and I've helped people avoid the surgery. And I do my clients, just as they come in, they tell me about their tooth infections, and then I give them the herbs, and they're always very surprised how effective they are and how they avoided the dentist. And even 2 or 3 years later, they still have the tooth with the hole, and it even seems like it heals a bit, but they never went to the dentist, never had to get the root canal, and they could avoid all of that because we know there's long-term harmful side effects of the root canal itself, besides all of the drugs that they have to use and painkillers and antibiotics that they're going to have to give you. So, and I did get a dentist, to confess. He was my client, so he was a little trapped in the appointment, but he did confess. And the question was, and there is a book called Confessions of a Dentist, by the way. It's called Drill, Bill, and Phil, or Drill, Phil, and Bill, Confessions of a Dentist. So if you want to understand how their business model works and how they make money, that's it. But like I said, I had one dentist here, and I did push him to the point where I said, if I'm capable of stopping the cavity from becoming infected, no pain, no swelling, nothing, then would it be okay to keep the cavity remain, whether it's on the side of the tooth or the top of the tooth? Would it be fine? He goes, yeah, but the problem is it will become infected. but I repeated the question. If I'm capable of stopping the infection in a cavity in my mouth, would it still be necessary to do a root canal or drill it out? And he said, no. The only reason we're drilling it out is to prevent the infection. So that is the secret, is learn how to stop the infection by yourself. One more little trick. There are ways to fill cavities. Beeswax. I've used beeswax. I've heated up beeswax. With my own children, cleaned it out, disinfected, rinsed it, hair dried it so it was dry, heated up some beeswax and stuck it right on the cavity and stayed there for 4 or 5 days. And I just had to keep repeating. And that was easier for a child than telling him to clean their teeth all the time. And that only works if there's a little tiny cavity right at the top. You can just clean it all out, put a little neem oil in there so it's all disinfected, rinse with some strong salt water and neem oil, and then dry it off with a hair dryer and fill it with beeswax. It won't stay long, but it will stay for 4 or 5 days if it's just a little tiny pinhole in the side. So I have filled holes at times with beeswax, and that does give you a break for about a week where you don't have to clean as much, but you got to keep doing it. So that's another little bonus trick there for you. This is all tricky stuff. Now I practice a lot on animals and avoid cavities on animals. I clean my dogs' and cats' teeth with the same powder that I'm talking about here today. I examine my dog's gums. I've seen inflammation in animals' gums before, and I have successfully reduced it down by changing a few things in their diet and using the formula. And I have a special little doggy brush just for doing my dog's teeth. So it is a good skill to know how to take care of your own teeth, take care of your own pet's teeth. And I guess I don't do this service professionally, but if you're doing an appointment with me and you ask me, how do I give me some tips on taking care of my teeth, then that's when I'll probably recommend one of these 2 products for you, give you a few tips, tell you a few things you can buy online and help you out. Okay, so folks, I hope that helped you out. And I hope this helps you to avoid gum inflammation and unnecessary dental work. Thank you very much.